to Stop Feeling Like Shit. And I'm your host, Daniela Korth. And today we have a special guest in the house. But as you know, Dr. Buzz is with us, then Joe Matovich from our office. And today we have Dr. Chris Yerington as our special guest. And I didn't butcher the last name, okay? And so today what we're going to be doing is we're going to be going over his journey that he started with our team over at Buckeye. And I'm extremely excited to get right into it. So, Dr. Chris, give us a little bit of your history and your background and your health history.
Well, Daniela, thank you very much for having me on today. I've worked with Joe over a few years here, and I'm meeting Buzz for the first time today, which is great. But my journey started about 5-6 years ago when I was done with my career, and my kids had gotten older, and I realized that I really wasn't healthy, and I didn't, even though I'm a physician, I didn't really know what the next step to take was. And one of the problems with being indoctrinated and educated in the allopathic medicine system in America is that you don't ever think outside the box. And my career ended because I ended up with a neurodegenerative condition that affected my brachial plexus on my left-hand side. I lost the good use of my hand. I also have some balance problems on the left, but that stopped my clinical career. And I will say I went through a bout of depression, felt very sorry for myself, but there were kids to raise, there were other things to do, and so I just kind of powered through, like I think most of us do in our midlife. And finally got up the kind of courage to say, hey, let's look at all the labs. And the one that, that I can remember very easily is I remember staring at my testosterone, which was only 183. And I was thinking, that's really, really abnormal for somebody in their upper 40s.
Mm-hmm.
It's like, that's too low. And
so also real quick, can you let the audience know, like, what is a normal range?
So the normal range for testosterone would be 400 to 800. Our country had that as the standardized lab value till about 1999. And then some of them began to switch to 200 to 400 being normal, even though Europe and Japan and Australia did not. They kept it at 400 to 800. If you look at curves from the 50s on when they were measuring testosterone, it peaks in your early 20s to 1200 to 1600, fades down to about 1000 by age 26 to 28, and then you'll lose 100 to 200 points per decade if you don't take care of yourself.
Mm-hmm.
However, what we've learned with age medicine in the last 15 years is that putting hormone replacement therapy aside, so everyone thinks you have to do a lot of stuff in order to maintain your health, and it's actually kind of backwards. You have to stop doing all the bad things.
I agree with
And
Yeah.
I mean, I think anybody who's in age medicine will agree that they can charge a patient, not that this is a great business model, but you could charge them nothing and say, sleep right,
Yep.
eat right, and exercise twice a week. And almost any human body that does it, males, and female hormone axis control is a little bit more difficult than males, and then pesky menopause throws it off for a decade.
Women are always more complicated,
Always
this.
more
Yes,
complicated. Yes.
Yeah.
But the act of sleeping correctly and eating correctly and exercising regularly for most males will improve every single biochemical and hormone marker in their body. And it will also return their body weight to within 10% of their genetic predisposition within 3 to 5 years.
Yeah.
But you can't tell a patient, hey, you're going to be really healthy in 3 to 5 years without taking a pill by just stopping all of the crap.
Right.
You don't want to feel like crap? Stop all the crap. But we use all the crap to get through the stress of the day, when the budget is tight that month, when, one of the kids is going through something, when there's employment issues that are being changed. We make choices that stress us out, then we sleep less.
Mm-hmm.
we sleep less, our coping mechanisms for controlling our food fall apart, and we have so many inexpensive, really poor quality food items in America to select that are full of additives that make you desire them like an addiction.
Yeah.
They make it easy too. It's so easy.
They make it so easy. And then you've not slept right and you've not eaten right. And how many people go, hey, I think I'll just go to the gym? They don't, because they feel like crap, which is the whole purpose of, I think, this podcast is you want to stop feeling like shit, stop doing shitty things to yourself.
Yeah, right.
Right. But once you identify that part, age medicine, and I will say this, in the last 15 years has done a marathon of research. You don't have to be just a male in your middle age. You don't have to be a 55-year-old male now. You can feel closer to 45, maybe even closer to 38 if you want.
Yep.
And so your answer on the testosterone is 400 to 800 is normal. I personally, and Joe and I, we shoot for my level to be at 650. 650 is commensurate for a in shape, exercising male between the ages of 36 and 42. And I feel good at that level.
Mm-hmm.
And I don't feel so good that I overdo it. And I don't have ups and downs with it, because we've controlled everything in my hormone axis. And we do that with 3 medications, Joe. It's the testosterone.
Yep.
The
anastrozole,
which is an
aromatase inhibitor.
It's an aromatase inhibitor, which, if I'm right, I may get this wrong. It prevents the conversion of testosterone to estrogen, and about 20 to 25% of males, their peripheral fat converts it over to estrogen.
Right. So it competes for the heme ion of the aromatase enzyme. So testosterone, and we don't use a complete suppressive dose where it shuts it down. Because
believe it or not, males actually need a touch of estrogen, or they will go nuts.
Just a little baby dose to make sure the ratio
dose,
stays appropriate. And then a GnRH analog, the gnadorelin, for pulsatile stimulus to the pituitary to keep the testicles active and functioning.
Your audience probably didn't follow that sentence. I did completely, because we spent $1 million on our education. But you take another medication that, because your body is not making testosterone in the testes, and you're adding it from the outside, that suppresses the testicles from going through their normal cycle over 6 weeks and producing sperm and testosterone. And so we give it's a hormone induced.
It's a peptide.
It's a peptide. It's a peptide that stimulates the testicles to normal function, even though you're giving exogenous
to keep them getting some stimulus. So we would say we don't want to go full nuclear option on the endocrine system. We don't want to make patients better in the short term, but potentially worsen them in the long term. Obviously, most patients, once they're on TRT, they elect to stay on TRT. I've decided I'll be on testosterone forever, but we always like to keep that in the background, kind of as a security blanket or an insurance policy for the patient, so that in the future, should you need or elect to come off care, we haven't just nuked the testes.
Shut your own system down.
Right.
There is a negative feedback loop there.
Well, and I always try to explain to patients, the testicles are like any other tissue in the body. The longer they're dormant, the more cellular health is going to decline. It's kind of like tying your arm behind your back for 5 years. If I tied your arm behind your back for 5 years, and at the end of that period said, you can have your arm back, go do all the same stuff you could 5 years ago, that would be a totally unrealistic expectation. Mm-hmm. With the reduction of stimulus to the testes, they don't just stay the same. They will decline and they'll atrophy. You may have some cell death. So it's better to keep the endocrine system functioning at some baseline level than tank it and then try to rescue it. Right. So,
So also, just real quick, what was your practice?
I was a clinical anesthesiologist. I practiced here at Ohio State University and the Mount Carmel Health Systems here in Columbus, Ohio.
Okay.
And that ended more than 10 years ago. And when you lose your career that you really, really work hard for, you go through depression.
Of course.
Yeah.
Which I chose to linger in probably longer than I needed to, but I was kind of stubborn and mad about it.
Yeah.
But I did all the bad things that I now mentor a lot of physicians that are aging on, their health, because a lot of doctors are now questioning what they were taught in medical school,
Mhm.
because they're all seeing the pattern that allopathic medicine has transformed in 25 years into a subscription service for chronic disease. And that business model is highly profitable, highly repeatable. And so our pharmaceutical companies and our medical industry, along with the insurance companies, are looking for ways to expand their business model. And the most profitable way to do it is to expand chronic disease identification and addressing it without curative motives.
Yeah.
And that is some people would call it amoral or unethical, but from a financial standpoint, from an economy standpoint, and I mean, Joe, you might know this, but I believe American healthcare now consumes 18% of our GDP, or
I think that's accurate.
some unbelievable number. I think the next highest country is Japan at like 10.5 or 11%, and then Germany at like 9. But like the amount of money and people that are employed, and it is a system that is self-reinforcing to the point where I'm not sure anybody knows how to get out of it. And I especially don't believe, because I talked to a lot of residents that are graduating, brand new attendings. One of the side things I tried to do, because I had disability insurance, and I'm thank God I did, and I wish I'd been better insured when that happened, but
Right.
you have what you have the day it happens, and that's what you get. But I advocated for about 4.5 years to medical students, residents, and young attendings to have the proper amount of disability insurance and really understand what it would provide and what it wouldn't provide, so that that could be part of their discussion with their financial advisors and their life planning, and I enjoyed doing that. But the oh, I forgot where I was going with that for a second.
I think a lot of times when you're getting out of school, you don't think your career is ever going to end. That's like the last thing on your mind. And
Right.
a lot of physicians, I think, especially in your field, but I think all physicians in general probably have a higher level of stress than
Oh,
the
sure.
average person.
Sure.
And stress breaks your health down at the end of the day.
Mhm.
And that's probably kind of how you ended up where you're at. I'm sure you were anesthesiology is super high stress.
It's exactly where, and I was a workaholic. I did, in my 11 years of being an attending, I worked over 80 and sometimes over 100 hours a week.
Wow.
Wow.
And there's no resting during that time. Like you're
No, and the other thing is you're standing on concrete that whole time. And when I came to you guys 3 years ago, 3.5 almost.
Yeah.
I have grade 3 arthritis in one knee. I have grade 4 arthritis in the other knee. I have not jogged in over a decade.
just from standing.
They wanted to do, just from standing and walking on concrete and pushing beds. The standard orthopedic practice, and these are my friends, are like, you need total knee replacements. I didn't want total knee replacements, and if I get them, I'd like to get them closer to 70, not
Yep.
closer to 50. And that, of course, is totally selfish because they only last about 20, 25 years. So I'm like, I'd rather have them at 70 and just do this once.
Yep.
Because if you have them near 50, you're pretty much buying a second surgery
Right.
at some point. I just spent a week and a half ago, I was out in Colorado. I hiked over 35 miles in a week at
Amazing.
altitude. Very difficult hikes, bouldering, but not rock climbing. And then I also did 17 miles of mountain biking, again, at altitude. And so my cardiovascular health has been almost completely restored in 3.5 years. My knees, we are going through a program I've talked about with Joe, and I've talked about it with one of the other physicians in the group, about the idea of remodeling joints
Mhm.
through functional, ergonomic use of them without repetitive injury. And this is more popular in India and China than it is here because they just can't afford the replacements in their medical systems.
Right.
And so what they advocate is returning to your proper weight and then utilizing the joint in a physiologic, functional manner that moves the joint through the proper motion again and again and again, and allow the body to remodel the joint to more normal. Does that mean I'm going to undo 25 years of abuse in my knees? Probably not. But could I take grade 3 and grade 4 arthritis and slowly move it back to grade 2, or maybe even grade 1 plus grade 2, and get 20 extra years on those knees? And so once we got my hormones fixed that first year, we moved into a second type of therapy with you guys, which is addressing the arthritis in my joints. And you did the smartest thing ever. Was you told me we're not going to do anything until you lose 25 pounds.
Yeah, that's great.
Yeah.
They're like,
How big? How much did you weigh? I thought that was really interesting.
So my highest weight was 299.8 pounds on the scale that I've used for years.
Were you naked, or did you have any clothes on?
I was totally naked. Totally naked, Buzz.
And how tall are you?
I'm 6'1".
Okay.
And I'm a bigger bone guy. I've got some wide shoulders, but 299 pounds. It's too much weight. You climb 3 or 4 flights of stairs, and you can feel your heart pounding in your chest, and you feel a little sick, and then you sweat. And I couldn't do any of the normal things. I love snowboarding. I was really, really, really having trouble. I couldn't keep up with the kids anymore, and I would come home and my knees would feel like they're broken for 2 weeks.
Mm-hmm.
And
They're not designed to carry that much weight.
no, and they're certainly not designed to throw 180s on ice walls at Vail at 290 pounds, which I did about 6 years ago. And I actually thought I was going to need surgery to fix that. That was how bad it was. And that's before I, met you guys. But I dropped down into the 280s, mostly out of fear, because when you hurt your body that bad, there's a lot of fear and anxiety that you're not going to be mobile, and losing mobility is one of the most anxiety-provoking things that can occur for a human being. And so I dropped down into the 280s, and I even dropped down. I think I hit like 278 at one point, and then it just floated right back up and tapped 288, 290. And I lost it again. It went back up. And so we did this 2 months on, 1 month off thing for about 2.5 years before I got introduced to you guys. And I can't remember who recommended you guys.
So how did you hear about Buckeye?
I think it was a police officer I was talking to about his knees killing him.
Yeah.
And he was like, hey, well, first of all, you should, you don't have to believe all of medicine and the orthopedics. They wanted to do all this stuff to my knees. And he's like, and I'm only 36. And I mean, watching him, he played football, and his knees were toast. But, he didn't want knee replacements. And he's like, I get these shots every 6 months to a year. And they got me on these pellets, and I knew what he was talking about, that he was on testosterone pellets. And so it was like, you know what, I'll try it. And I came in, and we started very matter of factly. It was nice to talk to physicians that weren't motivated by they're like, we want to get you to where you can get better and then approach your best. But that's not going to happen without your help.
Right.
I can't give you a pill. I can give you shots and fix your testosterone, but then you've got to address the fact that you make it really simple. I wasn't sleeping right.
Mm-hmm.
I wasn't eating right. And in my case, I wasn't eating bad food. I was just eating too much of it.
Yep, too much.
And I had given up on exercising because I felt like crap.
Didn't have the energy, and your joints couldn't handle it.
Right. And so about 3 months after I started on TRT, I actually found a trainer that, when I explained to him I didn't want to lift heavy weights again, I don't need to be Arnold Schwarzenegger, he did an assessment on me, and he said, well, he goes, your balance is crap, your flexibility is worse, and so why don't we start with those two things? And over 3 years, he has gotten me into functional fitness and a lot of yoga. And the yoga is so that, again, I move my joints in a physiologic way in order to remodel them. I endured a lot of injuries. I was an athlete in my 20s. I was a swimmer. I then did mixed martial arts, which is not great for the body 30 years later.
Yep.
I've had 4 shoulder surgeries, 3 knee surgeries, an ankle reconstruction, and I've had 3 hernias fixed. So I've done some damage to this body over time,
Hmm.
and it will ache if I don't take care of it.
You were hard on the equipment over time.
I was hard on the equipment for sure. But yeah, that's where we're at. So then once I lost that initial, because I came to you guys, I think it was about 285.
Yeah.
When I showed 282, 285, somewhere in there. And you were like, well, the first thing you need to do is lose weight, and we're going to start you on the hormone replacement. And then when I got down to 265 the first time, you were like, let's address the arthritis.
Yep.
And so, Joe, why don't you, because I can't remember all the names.
Yep.
For the choice of therapy that you guys did, but I had the first injection.
Yep.
Then 6 months later, another set of injections, and then a year after that, another one. And coming up in November here, I think I would be due again if I selected to do it again. But honestly, after what I just did in Colorado, I'm like, maybe I need to do it. Maybe I don't. Maybe I should wait until they hurt a little bit more. And that's honestly a visit that we haven't had yet. We haven't had that discussion. So if you want to give me a freebie today, you can.
Yeah. So I think it was in Dr. Mack and Dr. Bainan were obviously involved in that conversation heavily as well. So we started with doing, we've done several rounds of allograft tissue. So basically umbilical cord extracted allograft tissue that's a high potency of stem cell, right? The whole FDA can't say we did stem cells, but we did stem cells, right?
Yep.
You're using air quotes each time, so you're not really saying it.
Yes,
right?
exactly.
Just,
so it
makes
count.
it easier for the audience to understand.
Yep.
Yeah,
So
just to be clear, basically it's donated. People donate the umbilical cord from C-section births,
Right.
But why that's so good for joints is it has stem cells, it has long chain hyaluronic acid, lots of other proteins, and really all it does is help your body heal itself. It's almost like you're putting fertilizer in there. And I always tell people, if you're alive, your body can heal. So if someone's told you, you'll never get any better, that's not true. If you can move and you're alive and you're willing to help yourself, anything will heal.
Correct.
Yeah. So it's
as
really
long as
that
you
simple.
Sleep right, eat right, and exercise.
Yeah, you got to help yourself.
Yeah.
But junk in, junk out. If you're drinking alcohol every night, smoking cigarettes, there's lots of bad vices too. That's not going to help the situation. But you've taken your health seriously, and it's more of a team effort, right? So we can't fix you if you're not going to do the right things. But if you kind of go along with the program, the results are always good.
Yeah. And I know intermittently we were doing prolozone injections as well, just hyperoxygenating the joint capsule.
The effect each time. Right?
Correct. That's, because the joint capsules are so largely avascular, especially later in life, that oxygen and nutrient delivery as a whole is pretty darn poor.
Right.
So ozone is basically we call it CPR for the cells.
Yeah.
Right.
So those areas that don't heal on people are joints that are mostly avascular, elbows, shoulders, knees, terrible vascular supply. And we can't inject oxygen in there because
the body will just absorb it all instantly and right.
But ozone, which is O3, is even more potent because as soon as it goes in there, it oxidizes immediately, and it really stimulates your own stem cells to help that healing process.
So my sequence was first shot, then second shot 6 months later.
Yep.
And then you guys were like, when the pain comes back, which could be as early as 6 months.
Yep.
But not really greater than a year. That's the zone we want to do. And I steadily lost weight through that 18-month period, which now I'm at 30 months from my first injection.
Yep.
And like I said, what would it look like to maintain my improvement or optimization?
Yep.
Because I currently sit today with you guys, I'm 246 pounds, which
it's great.
That's that's the lowest I've been in a long time. I actually graduated college at 245.
Nice.
Wow.
Nice.
But I had 6 inches less on my waist. So
it was a different
one. It was a different 245. But my goal weight for my frame, age, and height is 215 pounds. So I will be losing another 30 here over, and we've talked about it here, over the next year to year and a half.
Yep.
Half a pound a week is the pace, no greater than that. And then train to maintain the strength, which means, again, focusing on my diet a little bit differently, but basically working at a 300 to 500 calorie deficit per day on average.
And and to answer your question, because that's a simple question, that's a loaded answer. When we look at regenerative care as a whole, it really takes it looking at the whole picture, right? Looking at the whole person. So, when we look at the healing capacity, yes, we introduce the allograft tissue containing stem cells. We introduce the ozonotherapy, right, to oxygenate the joint capsule. And that's essentially, like Dr. Buzz said, give your body the fertilizer it's lacking to get into the joint capsule itself. The other big piece of that as well, though, as you mentioned, is we did testosterone correction and optimization, and you're continuing that.
Yeah, and we did that first prior
to prep.
We got the body's physiology working first before we did a treatment.
And there's two other big pieces we did that only extend the duration that those regenerative procedures last, and that's we worked on correcting the HPA axis, and we looked at the gut as well.
Those are two big. Those are two big ones too, because if that HPA axis, I don't know what his look like.
Terrible, and that's what I was going to bring up. And
terrible.
I don't, and that's
high cortisol.
No, it surpassed. It was actually bottomed out.
Yeah, it
now.
was the other way.
It was the other way.
Phase 3.
And that's what I always
completely flatlined. So I was, and part of the reason that we did this is on one of my visits, I was like, I feel it crap in the morning, and I can't get going without 2 really strong cups of coffee.
Yep.
Mm-hmm.
And he's just like, well, if you don't mind doing this 2-day test, it was a 2-day test where you're giving samples, and he said we can get a lot of data about your cortisol. We get a lot of data about your gut.
They're both so important,
right? People who haven't been to medical school don't really understand that 80% of your immune system function is not only in your gut, right? But that 80% is like an army that is doing its training year round. And if your immune system does not have its army trained, it cannot address damage to the body or infection or invaders, parasites. So if you have poor gut health, your basic function of your immune system is completely hamstringed to address everything else, which is why you get sick with the cold and flu more often. It's why when you hurt yourself, you don't heal in a week. Like when you were a kid, it takes 4 weeks.
Yep.
Because the immune system, we all think about it as the thing that makes your nose run and you get a fever and it turns red and it swells when you hit yourself. And that's part of it. But, the major function of the immune system is actually the trauma recognition and repair system.
Yep.
We have 400,000 vascular injuries on average to our body every single day. This is just the normal wear and tear of moving around in a gravitational well or running into that table sticking out, which we've all done with our thigh one day. So we cause these vascular injuries all the time. And what happens when blood leaks out of capillaries and touches tissue is it activates chemical signaling, calls in the immune system, the cells come in, clean it up, and then it re-endothelializes and it refills. And this is a continuous process of the army doing its job, your immune army doing its job. If you are not training that army, then month by month, you get a degradation in the repair system. You get a degradation in the trauma recognition system. When the trauma recognition system inside your vasculature system does not work anymore, then your body is like, okay, well, this isn't getting fixed. What can we slap on this injury?
Yep.
And it turns out the body's really, really good at just putting fat and cholesterol and protein peptides and packing it into the injuries. Well, when this happens in our major vessels, we call it atherosclerotic disease.
Yep.
When it happens in your heart, we call it vascular heart disease or coronary heart disease. So addressing your immune system, being able to fix your body, starts with your gut health.
Yes.
It starts with retraining that army, which, by the way, there's not really a pill to take.
No.
It has to do with understanding that your body is designed for proper fuel. And if any one of us goes out and dumps kerosene in our car engine or, God forbid, just regular liquor, we will destroy our car's engine.
Yep.
Mm-hmm.
But, if we just put in, 89 grade octane and feed it the same thing for 15 years, it's got some additives in it. And, those people at, all the oil companies are really smart and trying to figure out how to get that car to work. But it's the same food all the time. And we don't think about fuel as providing the nutrients for the body in the proper way. And I'm not saying you have to eat the same thing every day for your entire life. In fact, that would also defeat the army because it would only be tested in one way. So like if you make your army only do push-ups and then you have to march 100 miles to fight, you're screwed.
Right.
On the other hand, if all you do is march and you end up having to go to a fight where you require upper body strength, you're also screwed.
It's a problem.
So the immune system needs to be tested, and thank God we live in kind of a dirty environment, and you know you're constantly challenged with you know the microbiome of this planet, and you know in a lot of ways that's how you stay healthy, is that life is in balance between the microbiome of Earth and you, and the interface for that is your gut.
Yep.
And so I was pretty shocked. I was sad in your office. I mean, I was sad looking at my results, and I think I even had like yeast overgrowth.
Yeah, off of those two tests, I think the two big things we found looking at the adrenals is, and I always like to clarify, the inference here is not adrenal disease. It's long-term maladaptation of the HPA axis, right? From
And
just
you'd
chronic years.
You'd said I was in the last stage of
You were,
cortisol, like because I had no cortisol.
Yeah, what we typically see is kind of phasal response. You know, people always are like, "Oh, I'm worn out, I'm exhausted, I'm stressed, my cortisol must be high," and that's really atypically the case of prolonged stress. I always tell patients, you know, your HPA axis as a whole is kind of like a car. You can drive a car really fast, or you can drive it for a really long time. Atypically, can you do both?
Yep.
So what we see is kind of two adaptations to chronic stress. We'll see that your body doesn't want to be under the ill effect of super physiologic cortisol all the time. So we'll see that the HPA axis will start to actively get tuned down, and cortisol production will start to drop.
And those are natural physiologic feedback
responses.
Loops.
Correct.
Right.
And then we also saw in your case, it's called your 11 beta HSD enzyme was also really active. Your body starts inactivating cortisol into cortisone to try to mitigate the effects of high cortisol. So he was in a scenario where what we saw was low morning cortisol, then a subsequent
so hard to wake
And
up.
that was the problem. I could not get going.
But like low morning cortisol, subsequent drop even further 2 hours later, low in the afternoon, and the only time it even tried to return to normal was at nighttime.
Wired.
When it started to climb.
Which of course made it hard to sleep.
Right.
Yeah, you're wired and tired.
Wired and tired. Now,
Right.
I will say that there may be, in my case, because clinical anesthesia requires you to remain calm in a very stressful situation. And I think that many anesthesiologists literally train themselves. They may not do this consciously, but they train themselves. And I can remember when somebody would hit a major bleeder in the OR, or we had a trauma coming up and they'd been shot several times or cut, or a fireman that had been in a partially collapsed building. And we were going to the OR, and we knew that there was a lot of trauma to the body. And we get to the point where it's not just minutes that matter, it's seconds and decisions. Oh. And you can't function if you're freaking out.
Right.
That, this person may die in front of you, that this person their body is broken very badly in front of you. Excuse me. So what you do is you learn to, I think what all high stress people learn to do is they learn to activate their own parasympathetic system to calm themselves down. And I can remember the more egregious the trauma, because I did trauma anesthesia at Ohio State, the more egregious the injury to the body that was coming to the OR, the lower my heart rate would be the moment I stepped into it. I sometimes could function with a heart rate in the high 40s for hours.
You just trained yourself that way over time.
I trained myself. Now I was a swimmer, so you also train yourself when you swim. That you have a diving response, which anybody knows if they go underwater, their heart rate will go down a little bit. It allows you to stay underwater a little bit more. It's a survival mechanism, but the ability to activate the parasympathetic system means your oxygen utilization is way better for your heart rate, and you're able to focus more. Scuba dive. Anybody who learns to scuba dive knows this. I mean, almost everybody who learns, they breathe too damn fast.
Yep.
And they're like, you don't need to breathe that fast. And you're like, well, I feel like I need to breathe that fast. I got air hunger. And they're like, slow your heart down. The air hunger goes away.
Yep.
So there's many ways that people adapt. But I think in anesthesia, I had adapted. And then once I lost that career, the stress of losing that and the stress of a life that, honestly, I had other people taking care of childcare through nannies,
Yep.
financial care through accountants. I had a wonderful life where I just got reports, and it was great. And then, all of a sudden you're living on less than half the income, and you can't afford those people anymore. And so now you're doing everything yourself.
Right.
And it doesn't really matter if you're competent at running your checkbook. The act of doing it means you have dozens of little decisions and thoughts, and that can cause anxiety, especially in somebody who, and you'd probably describe me as obsessive compulsive.
Yes.
I mean, just a little bit, a
Yeah.
little OCP.
Yeah.
Which
I
is
just-
was,
I would
was
That's,
describe
that's good for
my-
anesthesiology.
Describe myself as the
Right.
same way,
That's good for that
unfortunately,
group.
too.
oh yeah,
It's-
no, the whole field is OCP. Like you don't
Yeah.
want to walk into the operating room and see the anesthesiologist backstand not completely ordered where everything is exactly in place. You don't want to see an epic disaster like most of our home offices
Yep.
back there. That wouldn't instill confidence.
Well, they say you want that in your doctor. I was laughing. I had an appointment when I had my spine fused. I went and had a consult with the physician, and I think my mom was with me at the time. I was in my 20s, and I was like, "Well, if you want a second opinion, I can give you the name of the second best surgeon in town." She goes, "Well, who's the first?" He goes, "Well, you're already with him." And we walked out, and she said, "Boy, that was kind of cocky, wasn't it?" I said, "Dude, if I want anybody to be cocky, it's my anesthesiologist and it's my spine surgeon, and I want them to be cool as freaking ice, and to know that they've got everything." You don't want somebody nervous with those tools.
Yeah. So it was because we did a lot of things after that visit. So,
Yeah.
Oh, and the other thing was, what was the other? I had a sky high melatonin
Melatonin was
level,
enough
and
to
I mean
put an
truly,
elephant to sleep.
I think it was record breaking.
Yeah.
And I, like a lot of people, when you have sleep difficulties, what do? You're like, okay, well, you're supposed to take melatonin. So I got these 3 milligram gummies, and I started taking them. And you know what? Did it help me fall asleep about 10 minutes sooner? Sure.
Yep.
But I kept taking them instead of doing it PRN, which means as needed. I was just doing it every single night. And so when we measured my melatonin level, it was 1,000 times above the upper limit of normal.
Yeah.
And he was like, this is going to take months, if not a year, to probably correct. And he said, because every fat cell in your body is saturated with melatonin. So, he goes, I don't even want to test it for a year. And that's assuming you don't take any for 365 days, right? So, there are therapies that we think over the counter are helpful. And they are, when used, quote, as needed, right?
But everyone's different. Like
everyone's different, right? And
you might need
maybe some
melatonin, I
people
might not.
metabolize melatonin, but I certainly don't, right?
Yep.
So we obviously took me
Yeah.
off melatonin.
Yeah.
That was the easiest one. But how did we address the very, very poor cortisol circadian rhythm I had?
Yep.
And then I also did have a mild yeast.
Yeah, you had some candida overgrowth.
Right,
yes.
which is not abnormal in the American diet based on the food that we eat.
Right. And I think your big issue on the GI map was really didn't have a lot of overgrowth microbes beyond that yeast overgrowth.
Right. Now everything else looked okay.
But insufficiency in commensal and good bacteria, those were a little bit low. Butyrate producer bacteria were a little bit low, nothing egregious. But really that was the only big issue on the gut. So it wasn't astronomical, and the fix wasn't excessively complicated. With the HPA axis, we did some things supplementally like phosphatidylserine and different adaptogens, but a big piece of it, honestly, with you and everyone else, is a combination of lifestyle modification, specifically catering to how are you modifying exercise, what's your awakening routine look like, what does stress management look like, what's alcohol and caffeine modulation as far as how much intake is, what's our sleep hygiene and our nighttime routine, how are we monitoring intensity of exercise and things like that. I was, we use a lot of supplements in our office, but a lot of them, like the phosphatidylserine, it can help knock down ACTH, so it can reduce cortisol at nighttime.
Yep.
Which is probably why you use so much melatonin. I would say there's not enough melatonin in the world to overcome a significant upward trend in cortisol and all the metabolic and neurochemical consequences of cortisol rising abruptly when you're trying to sleep.
And you explained to me that my circadian rhythm was exactly backwards.
It was high at nighttime, trash
Right,
in the morning.
and that's
right?
why you go nuts from 8:30 to 11:30, because your body wants to go, 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 go.
Yeah.
And really, what we want to do is have that happen at 8:30 in the morning to 11:30 in the morning. And we haven't retested that, but
Nope.
the plan is here to retest everything. It's not quite been a year.
No, almost.
But we'll at some point
Phase
do
3
this.
takes about a year.
It does.
That's the longest one.
Right.
folks.
And and I'm up for another injection in the knees here at some point. And I haven't really discussed whether we do that like at the year mark, or do we wait for that to start having.
And I think the big reason I brought up the things regarding the gut and the HPA axis as a whole as well is,
it's only going to work better.
It's
this
only
time.
working
It's only
better.
going to work better
and,
this
and
time.
I think
because-
working on those things has
Right.
probably facilitated it stretching longer than maybe when you first came as a patient, we would have anticipated you getting benefit from care. And that's an honest conversation. We have a lot of patients when they ask, how long is this going to last? Well, that kind of depends on what you do with it. Right?
And there are other things that have improved over this 3 years. I just, I think of them as little things. I was diagnosed in 2016 with obstructive sleep apnea. Again, big guy, weighing
big
close to
guy.
300 pounds. I mean, I'm only 6'1", but 300 pounds is just way too heavy. So I had obstructive sleep apnea, and I've been very compliant with, using my appliance, as they call it. Yeah. So admitting that you're a tube head on a podcast is not great.
That's
but-
okay. Chris is the one that talked me into finally getting a sleep study and using my CPAP.
Yeah. So
Oh,
Yeah.
nice. So
Yeah.
your wife didn't work, but Chris did.
Yeah. So, he's actually, after we had that conversation, I went and did my sleep study and got a CPAP
my pressures have dropped
significantly. I'm assuming.
significant. Well, they dropped a little bit from 16 to 22 when I started here.
Yeah.
But every year over year, we've reduced, and I am now on the lowest setting my machine offers. And my sleep medicine team is like, if you continue to lose more weight, there may be a moment where we start to trial you off the machine.
Yeah.
And I said, okay, well, tell me what that's like for patients. And they said, well, and this is just my the one practitioner has 5,500 patients that she follows.
Wow.
She says, you would be the first one to get off CPAP because you've changed your body.
Yeah.
That's amazing.
Wow, that's
The
awesome.
first
huge.
one.
Yeah.
Would
And
you
she's-
have
and
you
she's
been
been
able
doing
to
it
fall
for-
asleep without that thing on your face?
I would have to train myself.
Yeah, because I'm sure you get used to it. And the noise.
Mine is super, super quiet.
Oh, it is, okay.
But there is a white noise component, and obviously, like Pavlov's dog, if you do the same thing right before you fall asleep, you are literally training yourself. Okay, I hear a little white noise. I've now converted myself to actually just using a nasal pillow. I don't have to use the whole mask. And that I went through. I actually had somebody who taught scuba diving was like, this is how you train yourself to breathe only through your nose. And so, yeah, that was me watching, binge watching Netflix with my mouth taped shut, wearing my appliance, in the evening.
I can't imagine.
Oh my gosh, it took me like 90 days. And I think that, it's funny, you go very far in a profession, or you go through a lot of education, and you think you can do anything. I went very far in education, all the way through medical school and residency, and all the trials and tribulations and stress and endurance and tenacity that it takes to do that. And here I am trying to teach myself to breathe through my nose at night.
Yeah.
And I'm like, why is this so hard? Right? Why is it so hard? But that was one of the things. But now I'm at the point where I might get off of that.
Might get off of it completely.
When I started with you guys, I was on 5 prescription medications. I'm on 2 now.
Okay,
Awesome.
that's awesome.
I'm on, and not only that, not only am I on 2, but they're both at half the dose they used to be. So,
Wow, that's awesome.
so like there is this progression where if I continue to have my physiology tuned, maybe even optimized,
Yes.
I continue to sleep right, eat right, and exercise within the limits of my, approaching 60-year-old body, I could be medication free, CPAP free, and return myself to where I was 30 years before, and then optimize myself. And I'm going to have total knee replacements at some point.
Yeah.
I've already bought the damage. I don't think they're going to make it to age 100 by themselves.
Right.
But wouldn't it be great to push that off 20 years because I just simply took better care of myself?
Yeah.
Yeah.
And I think that's one of the gifts that age medicine is starting to give our civilization. We've really had this one choice allopathic medicine. It really crowded out osteopathic. For those of you that don't know, that's chiropractors. The allopathic path has been endorsed and reinforced by the pharmaceutical industry and the insurance industry. But it turns out that while it is fantastic at addressing trauma, it's less fantastic at curative motivations for chronic diseases. And what we're learning in age medicine is that the combination of not doing the bad stuff to your body and then really small steps towards allowing nutrients to be delivered more efficiently, physiology and biochemistry to be optimized, oxygen delivery to be optimized. That's a big one. I mean, I make no bones about it. If, you men out there that are listening to this, have your wives, have your partners, or do this yourself. Just put a video camera on you and watch yourself fall asleep for that first hour. You will know whether or not you have a breathing problem. It is very, very obvious.
Really? Okay.
That's what
Yeah.
Jamie recorded me the first hour I was sleeping, and it's funny. She did this, and then Chris and I had an appointment the other day, and it halfway turned into an appointment about me. I kept my beard though. You told me I was gonna have to shave it.
No,
I kept it.
I did.
But Jamie played it. She goes, "I just need you to hear this." It was dark in our room, so you couldn't see me. It sounded like somebody was performing an exorcism on me the way I was snoring.
It sounds like death is close.
It does.
Yeah.
It does.
Yeah.
It feels
I
like
have
it
him
too
sleep
when
on
you
his
wake up.
side. Like if you're a back, I'm a back sleeper. I can't sleep on my sides at all. And so if he sleeps on his back or starts, I might punch him. I'll be like,
On my side, I'm
Are
fine.
we
But if I
snoring?
sleep
over?
Buzz, are we snoring
on my
tonight?
back,
On
but
his
I
back.
can't fall asleep on my back anyways. I'm a
Yeah.
side
So once
sleeper.
you
He's fine.
once you go to side sleeping,
Good.
He's
you're
fine.
Well,
yeah.
Yeah.
It was so funny for me though too, and it's amazing how casually we take things, because I went on that way for years, not getting it addressed. I'd fall asleep like that. I'd wake up, my heart rate would be 170 beats a minute. I'd be gasping for air, and then 2 minutes later, go back to sleep. And it's
So
like,
when
how
I w-
stupid.
This is how bad it went. That doctors, we're not the greatest patients. And every nurse out there knows that. In fact, we might be the worst patients on planet Earth. I didn't want to admit I had a problem when I went in and got that sleep test, and they drew a bunch of blood because I was complaining about, I had absolutely pounding, piercing headaches every morning, and
Wow.
my chest would hurt.
Yeah.
Yeah, that's
And
not
then
good.
they asked me, how long's that been going on? And when I said 3 years, 3 years to wake up with piercing headaches, which
every
I
day,
was just
every
like,
day.
it was caffeine withdrawal. All I got to do is have some coffee, right? Well, it turned out really what it was oxygen withdrawal. And what I really needed to do was breathe for an hour before my headache would go away. But they drew blood and showed markers that I had chronic cardiac damage
Wow.
and there were neuromarkers that showed damage. So I was slowly killing my
You
brain
had
and my
hypoxia all
heart
night long.
because I had
Yeah.
hypoxia all night long.
Wow.
And you can only do that for so long before it's going to kill you. And the stress of that reduces your immune system. Like we talked, the Army no longer trains.
Yep.
Because all it's doing is it's in survival mode
Yep.
to undo the damage that you're doing every night. So you get sick all the time.
Yep.
And, nothing really gets better because you're not underlying you're not addressing the real underlying problem. And for me, obviously oxygen delivery, that's a very, very important thing for remaining alive. And once I got that fixed, it took a few years till I felt normal again. And then it took a few years after that for when I was like, hey, I want to feel better and I don't want to be this heavy anymore.
Yep.
And then we started, the journey towards coming, which ended up coming here to Buckeye.
Yeah.
And like I said, we've got a ways to go.
Yeah.
I have 30 more pounds to lose, which we're going to accomplish, between now and the end of 26.
Yeah, I think everyone, your health is a marathon, not a sprint.
It is. And I think
And you'll always be working on your health, whatever that is. Like as soon as you
Absolutely.
quit thinking about it, like,
and the older you get, your health needs change.
well, it's kind of like a car. The older a car gets, it needs a little more maintenance.
And sometimes it's harder to find the parts.
Yeah. But as long as you maintain it, you can have, like, we have an old Camaro that's like brand new, but there's a little more work to it. But
Yep.
you put the work into it, you can have a 60s car that's as nice as a 2000 or a new car.
Yeah, and they can't track that one or shut it down.
Yeah.
Yeah. That's why we keep it.
But yeah, no, I've thoroughly enjoyed this journey, and I tell my journey to doctors that are like, I feel like crap.
Yeah.
And, a lot of it is they're burnt out from their jobs, their marriages, especially in midlife, especially in the 50s. Kids are finally leaving for college, and they realize that they've dedicated everything to their careers and their kids. And they're now in that last phase, the last third of their careers, which is pretty much set if you've done everything right and you're competent. So there's no more ambition or climb. There's just maintenance. When the kids leave, then all of a sudden it's just the two of you. And if you haven't worked on staying together and complementing each other, you end up spinning it out of control. And that shows up in a lot of different ways: overworking, overstress, money problems. I mean, we call it collectively the midlife crisis.
Yep.
And then the other problem, and again, I mostly talk to physicians, those that are approaching retirement, they don't have any balance in their life. And when I look at my own journey of health,
Well, just work all the time.
Right. What's really, really worked on my body is the fact that we've rebalanced it. And, are there little tweaks to optimize? Like you said, as we get older, we're going to have to take care of it. And I joke that the parts are going to be harder to find, but the body is the most amazing machine that, and I,
Well, from working in trauma, the resilience of the human body.
I have gotten to have, I think, a very, very unique view. I understand pharmacy and physiology much, much better than the average human being. And in fact, it was a passion of mine to learn in my upper 20s and early 30s. So I really enjoyed learning about it, and I enjoy learning. So those two things together allowed me to go as far as I wanted to understand. And at some point, you see some people point to it as being an intelligent design, but you can see the complexity itself feeding back into the complexity and why it is the way it is. And you're like, wow. And all it really needs is oxygen delivery and proper nutrients.
Yep.
And then allow it to rest at night. Don't feed it crap, which is honestly more important than eating the right thing, is the don't eat the crap. Right.
I get that.
And then don't poison it. Don't poison it with the air, the water. That includes smoking. And, you were talking about when we did the gut health thing, you were like, hey, you need to drink less alcohol. Yeah. So, we've gone 10 months and I drink 90% less alcohol now.
Yes.
I drink like twice a month instead of taking 2 days off a month. I mean,
yeah.
and it's not that I drank a ton, but I enjoyed drinking, and that was a constant source of empty calories.
Well, and you even look at that too, just from an adrenal standpoint, right? A lot of people have a couple drinks a night because it helps them go to sleep, but we know alcohol's interaction with GABA receptors will then cause a rebound in GABA withdrawal and raise cortisol and destroy sleep architecture. So it's like, you
fall asleep at it, but
slept
your
like
sleep's
hell.
garbage.
Yeah, you slept like hell for 90 minutes.
You
and
were
then
just
bad
like,
for the
hey,
next.
your cortisol levels were sky high, so you went and had a couple drinks.
Yep.
Well, that got you calmed down enough for an hour and a half. And when you woke back up, because one of my complaints was I wake up at 12:30 and I am jazzed till 3 a.m. and then I
That's the worst.
crash hard. And he was like, yeah, on the nights you drink, that's exactly what happened. And I was like, huh.
Yeah.
It is on the nights I drink way, way, way more than the days that I'm like, I really controlled my diet. I stopped eating by 7 p.m. I exercised really well today, and then I took care of myself in the evening by not jamming screens in my face for the last hour of the day. And I was like, yeah, shockingly, if I actually read a paper book, those 40 minutes before I want to go to sleep, it's just all smoother. But and so just, taking care of yourself. But the journey for me here in my 50s and learning to do it again, having the pre-knowledge, like I said, of allopathic medicine, all the things that I've done. And there is some cost to what I'm doing. There's a maintenance cost to anything you're going to do, whether it's gym memberships or hormone treatment. But, the fact that insurance doesn't pay, at least for me, to do this. I know some insurance companies are starting to change their tune out there. The amount of cost compared to what has been spent for my multiple surgeries and other treatments, you can see the cost differential, even though I'm paying it out of pocket, right? As
Yep.
opposed to an insurance company paying it. But the motivations between those two systems are very, very different.
100%.
And then you look at, and I have been privy to, because I've worked with so many medical students and residents, their medical education through the years has gotten more and more edited to you identify it and you chronically treat it. And, I try to sometimes have conversations about, do you ever critically think about what you're doing? And
It's hard
You-
for them
you-
because they don't have enough time the way the system is. I mean, how
well,
much-
and also there's no financial incentive to tell a patient, hey, you need to stop eating these foods and get better sleep.
right.
There's no ICD-10 or 11. I don't think we're on ICD-11
Yeah.
now.
Yeah.
Well,
I don't think there's any code for, hey, I told them to take better care of their body and stop all the crap. Like, hey, you want to stop feeling like shit?
Yeah.
Stop doing shitty things to your body.
Right.
But I can't bill for that. I don't get
Right.
$225 out of an insurance company to say, stop being a jackass.
Mhm.
Whereas when you engage age medicine, like, I can tell you to stop being a jackass, whether you do it or not.
It's on you.
Right. And
Yeah.
if you want my services, this is what it costs. So, I have skin in the game, and I can tell you this with the knee injections.
Yeah.
The 3 months after I got each one of those injections, that is one of the cleanest 90 days of my life, because I'm like, this was expensive and I'm going to take care of it. Like you buy, I don't know. I mean, we all buy
Like when you
little
buy your kids,
expensive-
if your kids buy toys for themselves, they take better care than if you just give them stuff.
Right. I mean, I can remember the first pair of sunglasses I bought with my own money. It was I was a lifeguard at 16, and I bought a pair of Varnays that had the leather on the side to protect the sun, because I was out in, under in the sunlight for 14 hours a day. And I wanted a really good pair of sunglasses. And it took me forever in the 80s to earn that much money and pay for those. And I was really, really proud when I bought them.
Yeah.
I treated that pair of sunglasses so well. I don't even think I got a scratch on them for a decade. And then finally, I 20 years later, I found them. The leather was all cracked. The lenses had a couple things, but I was like, wow, I paid $100 for this and they lasted 20 years. I mean, it's really only $5 a year cost.
Yeah.
But it was the first thing that I really, really cared for, because it was really expensive. And I had skin in the game because I had mowed lawns, and I think I even worked at Pizza Hut, earning money at that point, making, for all you kids out there, making $1 something an hour.
Yep.
And you care. And the same thing happened when I got my knees injected. Like, you have to take care of this so that you get the maximum benefit for the cost you put in. And that's another problem, I think, with American medicine, is there is a detachment between the patient and the doctor and the insurance company paying the bill.
Yep.
Such that the motivations, it's a trinary motivation that really, if you drew Venn diagrams, they kind of overlap, but don't really.
Right.
And I think that's one of the reasons that so many people feel like crap, is because we have twisted the motivations.
I think a lot of people too will, maybe in the back of their head, they're like, well, if it was that good, why would insurance cover it? Is something you'll commonly hear. And I always
Right.
explain to people, all insurance works the same way. Like, you have car insurance.
Right.
Does your car insurance pay to wax your car or change your tires when they get bald? The answer is no, because it's not catastrophic. But if you crash your car, then it's covered.
Right.
So do you want to wait until your health condition's catastrophic so your insurance covers it, or do you want to maintain it?
And it gets even worse if you want to use your metaphor, when the car insurance company owns the car repair shops,
Yeah.
Yeah.
because that's American health
Painfully
Yeah.
accurate.
right
yeah.
now. The insurance companies own the PBMs that run the chronic things. They own partial ownerships in large healthcare multi-state systems. They don't own it outright because I don't think they can.
They're probably
So
not
they-
legally allowed to.
So they
but-
own it, third-party peripheral financing, blah. I mean, there's so many complicated ways to put the financial instruments together, but the motivation to extract money through employment, through employers, into this insurance base, and then pay yourself all of the money, creates it creates a moral hazard that I don't think that the hierarchy of human beings can stop. And I hammer on this a little bit more than probably you wanted me to in the podcast, because I think that's the system. I think it has to break. And so I hope that there are 1,000 other Buckeye anti-aging out there across the United States, so that when it breaks, people can actually have access to healthcare. And I know you guys focus on age medicine, but it really wouldn't be a large leap to start doing some concierge medicine that would be
even concierge primary care and things like
right.
that.
No,
right.
Just the simple things. I mean, there's for most human beings, there's 11 things that go wrong with them over their lifetime. That's it.
Yeah.
It's the same 11 things for 99.9% of us. I mean, and it's not that hard to address. And if you had skin in the game to address it,
100%.
a ton of us would be like, okay, well, I need to save money because I'm on a budget. What if I don't buy the cigarettes? What if I don't buy the alcohol? What if I put the snack food with 57 ingredients back?
Yeah.
And if I'm going to have a snack food, I pick one that just has 4 ingredients in it.
Yep. And I can read what they are.
Right. I can read what they are. I can pronounce the all the syllables.
Yeah.
I love when people say, I don't have enough money for hormone replacement therapy. It's so expensive. And then they're buying 5 Starbucks per week.
Yeah.
And I'm like,
Like I
aren't
said-
those like $10 each?
Yes.
Yeah.
So, there it is.
Yeah, even at $7, I mean, that's $140 a month. That is hormone replacement in depending on what you're getting. So there's so much better we can do. And I love by the way, I love the title of the show.
Yeah.
Oh, that was her.
Yeah. No, I love the
Yeah,
title because it really is. We do a lot of crappy things to ourselves every single day, and they become cumulative over the decades. And then we finally get into our upper 40s and 50s, and we go, I don't want to feel like crap anymore.
Yeah.
And so you go to your doctor, say, I don't want to feel like crap anymore. And they say, here are these 5 medications that you're going to refill every month, which are going to take all of these symptoms and fade them out a little bit. But
most medications don't do nothing with the root cause.
Right. Right. They only address the end result, right? If you're walking around on a leg bone that has a crack in it, not a fracture through, but it's got a crack, and it hurts really, really, really bad, you can take enough narcotics to walk around on it all day.
Yep.
It will take 10 times longer to heal than if you took an x-ray of it, say, hey, you got a crack in your bone. Why don't we put you on crutches for 3 weeks and then advance is tolerated, right? Let's just do something simple, right? But instead, 10 months later, you're hooked on narcotics. You've had 10 visits, and the system got remunerated for that, but the patient didn't get better.
Right.
And I would say a lot of people get trapped in that too. And that's one of the things that people struggle with, I think, probably with age management and functional medicine is, traditional medical care has people trained for the immediate fix in a lot of things, where if I take this now in 30 minutes, it's going to feel better. When you're doing age management or functional medicine, it's funny. It's really not.
You're getting your body to heal itself, but it's like you're putting fertilizer in the garden. You're not going to have flowers the next day.
But it's really not complicated, right? It's like you said. It's appropriate nutritional intervention. It's dietary and lifestyle modification. It's exercise. It's sleep, and those all facilitate the body healing itself. But they're not instantaneous.
No,
it takes time and effort.
I remember back to, it was either the first visit or the second visit, because I was like, I really want my knees better. And somebody just leveled with me, and they were like, you really want to do this right? I'll tell you, it'll take 7 to 9 years to remodel your knees. And I'm like, what doctor says, hey, by the way, it's going to take 7 to 9 years to fix this? And I was like, but it's grade 4 arthritis. It's bone on bone. And they're like, and I'm telling you, in India and China, if you do the right things for 7 to 9 years, it all goes back.
Yep.
Your body will heal itself with the proper oxygen and the proper nutrients and the proper physiologic motion. If you're going to go take that knee and play indoor soccer on it 3 times a week, the bone is going to grind to a fracture. But if you'll stop and you'll be smart, it'll take time. And even there was a patience to it that I was like, well, wait a second. Is there any reason that won't work? And then as a doctor, I'm a pretty good researcher. And so you start looking into it and you're like, oh no, it really will work, but it's not a pill so that I feel
Yeah.
better in 30 minutes.
Right.
You know, it's a choice to not have that extra snack every
Yeah.
day for 5 years. It's a choice to, you know,
Go do yoga or go work out.
right, drink water with a little lemon in it or tea at the end of the day and not out an alcoholic nightcap,
Right.
Mhm.
right? And it's little things, consistent things, and it's very, very, very hard to teach because our civilization, our capitalist economy, is about creating transactional events as quickly as possible, so that money will flow as quickly as possible around, so that you know, honestly, everybody can get paid and everybody can have a job, and those are great things.
Yep.
But if you look at 50 years of kids coming out of school with a worse competency than the year before, 50 years of chronic disease climbing.
Yeah.
If you look at those things, you're like, well, maybe we shouldn't run human life like a widget factory
Yeah.
Right.
and see how fast we can crank these widgets through each, you know, manufacturing from age 20 to age 70 that we can do, because we're doing a bang up job of really just degrading the average person in society. I think certainly mentally,
Mhm.
Yeah.
and now we're watching the physical collapse.
You're seeing hormone levels are decreasing. Like if they,
Yeah.
in general, people's health is getting worse.
Right. And I'm not saying there aren't, you know, big sweeping underlying things. I mean, I think our water quality has gone down. I think that we package far, far too much stuff that we put in our bodies in plastic.
Mhm.
But there are, you know, plastic is cheap. It's light. You can't put
Yeah.
everything in aluminum and glass because it's heavy and it's more expensive.
It's
and
recyclable.
Yeah, well, it
Yeah,
is
yeah,
recyclable. And, you
yeah.
know, if we
So you can use it
if we had
Right.
motivated
out the
recycling,
amount of times
right?
over.
If we had motivated recycling to get there, but again, recycling is actually curative.
Yeah.
Right. It's not a subscription process. Like oil to plastic is a subscription. We're
Okay.
still taking it out of the ground. We're making
Yeah.
it into something.
Yeah.
and- yeah. So, but
Always,
yeah,
always follow the money.
always follow the money. But yeah, no, I'm so glad I got to talk about my journey
Yeah.
at Buckeye here, because I normally do this one-on-one.
Yeah.
And we didn't even, for those of you that are listening, we've had no pre-discussion. I met Buzz here an hour and 10 minutes ago now.
Yeah.
Yeah.
And, but I'm excited to talk about this because, you know, once you're a doctor, you're never not going to be a doctor. Even though I've kind of converted myself to being more of a healer than a doctor, I'm not going to ever write prescriptions again. You know, and I can only really advise somebody to do the best they can for themselves.
Yep.
Yeah.
That's a choice they have to make.
Right. But it's amazing how freeing it is. I don't have a monetary motivation to talk to somebody about making themselves better.
Mhm.
And so I can tell them that what their doctor wants them to do, you know, yeah, that's one in the list of things, but these 3 things, you might want to try these first.
Yep.
And sometimes trying the simple stuff, you know, I did the old joke that we all hear in medical school, you know, doctor, it hurts when I raise my arm like this. We'll stop doing
Yeah,
that.
don't worry.
Right,
No
right,
reason.
we'll stop doing that, right? So yeah, I just I think the approach in age management, and especially is the right approach for making the human being holistically better.
Yes.
100%.
And it's good for us to have somebody has so much education and experience, and quite frankly, like what is the traditional allopathic medical machine that most people are stuck in, who's been able to experience both sides of it and has all the background physiology and understanding of.
I would say
how these things
allopathic
apply.
medicine in the U.S. is the best for trauma care.
For sure.
Absolutely.
Yeah, there's
that
nothing- there's
that
no
model
better.
has been expanded globally because it is the best. And you know, I didn't, I don't know if the word awaken is the right word, but I didn't really become aware that the allopathic system, you know, you kind of functionally know this, but to truly believe that it is motivated in a way that is not curative, you have to go through an experience.
Well, it's really sick care. It's not health care. So if,
Yeah,
if
it's,
your insurance will never make you healthy,
disease for profit care.
correct.
Yeah.
But if something bad happens, it's good to have. I mean,
It's great.
it's the best. But if you're looking for what your insurance covers to determine your health, you're in big trouble.
Yeah, when I first got disabled, I was in an amazing amount of pain. I had nerve injury down the left arm, from the neck, from the brachial plexus. And so even though I was an anesthesiologist and I'd even done some pain management at Ohio State, and I knew everything you can know about neuropathic pain and how it's generated, and what I didn't know was how to live with it day in and day out and wake up with it in the middle of the night a dozen times. And so I did what normal patients do. I went to my colleagues at that time, and they were like, great, we'll put you on this and this and this,
Yeah.
and it'll dull the pain. 3 months later, that wasn't working. Well, we'll do this, this, and this.
Mm.
And then that would stop working. And then they were like, well, let's put you on a little bit of narcotic.
Mm.
And 3 months later, it was a little more than a little.
Yeah.
And 6 months after that, it was not, I didn't want to take any more narcotics. So, I'll have a whiskey with the narcotic.
Yeah.
Yeah.
Because you're disabled. And it's this just slow roll towards, what are you doing?
Mm-hmm.
And so then I was just like, there has to be a different way. There has to be a different, like, it can't just be like this. You just can't throw drugs endlessly. The underlying problem with the nerve is X,
Yeah.
right?
What's the root cause?
So, right. So how do we address the root cause, right? And sometimes addressing the root cause, in my case, meant that I needed to do some things that were exquisitely painful to my left arm again and again and again, so that I could get the nerve to be less reactive.
Mm-hmm.
Mm-hmm.
And then I would have to keep those up as, I spend about 10 hours a week doing what would be considered OT and PT, occupational therapy on my hand, and physical therapy for my upper body. And it's great. I kind of have a gym body back, but I'm not focused on the strength anymore. I'm focused on the symmetrical use and functionality. But having to go through and then they were just like, well, we can start to go in and kill the nerves with radio frequency ablation. And I'm like, this is where we are with chronic pain. And I had even done this stuff years ago, myself. But my thinking, I was like, this isn't right. There has to be a different way. And once you start thinking that way, then all of a sudden you're open to, okay.
Well, I think it's just getting your brain around the fact that the body is, from trauma, you've probably seen some bodies that you thought there's no way in hell this person's going to live, and they survive. The body's very
I have
robust.
I have seen some amazing. I'll tell you, the most amazing thing I think I ever saw in medicine was a 22-year-old girl with, she had osteosarcoma, stage 4. And she came in for just a simple port removal. So like, when you have advanced cancer, often they'll put a permanent IV in your chest, and that way they can administer medications without having to do 100 IVs on you over a course of time. So I believe they were taking one out and putting a new one in, or it was a simple procedure. And she had gotten kind of sick in recovery, and she went downhill, and it was weird. It wasn't sick like surgical sick. It was like the worst. It was like a flu, that every hour there was more coughing, spiked a fever. And she'd even reported that, she'd had a cold, like I think the week before. It was a very simple thing. And I watched her in 15 hours go from coming in to have something done to in the ICU on a ventilator.
Wow.
And I'm like, wow. And I'm like, she's going to die. She has end stage cancer. She's one of the sickest people in the ICU for about a week that I'd ever seen. But her young body kept on going. It was a young body. And then she woke up, and then the ventilator came off, and
Wow.
she got out of the ICU about 2 weeks, maybe 2.5 weeks. And she had to do some recovery. She had some deconditioning. And shockingly, she was cancer free.
That's amazing.
Wow.
Really?
Cancer free. So what is believed that happened?
She was so sick that made the cancer died.
Well, the virus or the flu somehow activated her immune system, or that army. It somehow trained her own immune system to recognize the cancer cell as foreign. And so her body attacked the cancer,
Amazing.
nearly killing her. I mean, if we didn't have modern medicine or trauma care, right, she would have just died. But because we were able to support her body through that, and so like it's not taught in medical school because it's incredibly rare, right?
Right.
And even if you believe that that's the mechanism, like how do you get the right genetic code in the virus to activate the right immune system at the right time to recognize the right cancer before it's, so the
Wow.
by all definitions, even if you added up all the statistics, it's still a miracle and it would be rare to happen. But what it showed me was that we don't know nearly as much as we think we know about how the human body functions. And it's really amazing. It is so hardy, all the damage we do to it. I mean, all the shit we do to our body
Yeah.
all the time. It's amazing that we still function day after day after day after day, decade after decade, and still get all of our stuff done. So it really is a remarkable machine and system. And like you said, it's actually very wonderful to have had the knowledge in the one world.
Yep.
And then spend the last 5 to 6 years going, no, I'm not sure that has all the answers. And every time I do the right thing consistently, I get better over time.
Yep. And
now I'm layering those things on top of one another. And I would invite anybody who, it doesn't matter where you are, but men over 40, and hopefully you're not quite 70 yet, even though you could start at 70. And I believe the literature says the older you are, the better all this stuff works, at least percentage wise.
Yes.
Yes.
So a 40-year-old, if you put him on the same therapy as a 70-year-old male, the 40-year-old might get 10 or 20% incrementally better, but the 70-year-old might be 100% better.
Yep.
In the same, and it's the same thing with the gym, right? The
Yep.
older person that goes to the gym,
But someone who doesn't exercise at all, just a little bit, makes such a
gets
huge difference.
far more
Yeah.
benefit from doing something. So, I'm
Well, that was a great story. Really
Wow.
appreciate it.
Yeah.
that was great.
Normally I'm more talkative and whatever, busting the chops. But I mean, I really was into it because what a great story.
Well, I've told this story to 100 doctors here locally in Columbus,
awesome.
Ohio, between the ages of 35 and 65, who are struggling in their own life.
Yeah.
And I'm like, look, dude, it can get worse. You can have your career ripped away from you.
Yeah.
You can then
You're like, look at me. Like,
Right.
I'm telling you now.
Well, and I didn't even think that I'd done such a great job. A lot of us, we're our own worst critics. So like
Yeah.
I look at my life and I criticize, well, you didn't earn a lot the last, 10 plus years. You didn't. Yeah, but look at all the other stuff that I did. I just seeing it as an accomplishment
yeah.
through the mirror of yourself is sometimes very, very, very difficult. And I will say the other thing, quite frankly, getting my head out of my ass was incredibly difficult in my own life. And part of that may be the fact that I was a doctor. I mean, I do know
You had a
that
deprogram from work,
Yeah.
work all the time, and probably zero attention to your own health.
but it's also a knowledge gap, Buzz.
Yeah.
You think you know so much as a physician, especially as a physician, right? You think you know so much. And then all of a sudden, when you have a problem that cannot be fixed with that knowledge, or worse, in my case, it just started making it worse.
Right.
Well, I just we just met this doctor at an event we were at, and he has severe hip pain. He has arthritis in the hip. And so I told him how to fix it, right? I said, this is what you need. And then so I was at the airport. I sent him this stuff. I told him, look at it, blah, blah, blah. So then he messaged me yesterday and he goes, listen, I looked at it. And he goes, it's too much work. It's complicated. I said, hey, listen. All right, that's fine. I said, do you want to save your hip or do you want a hip replacement? I said, because that's on you. I'm telling you that this is how you fix it without getting a hip replacement. I said, but if you think that this is too much work, I said, then so be it. I said, if you don't think somebody can come and draw 16 tubes of blood, which is cake, that's a problem, And he practically told me, he's like, my blood draw person is not that skilled. They can only draw 1 tube of blood. And I said, then you need a new blood draw person.
Yep.
Like, don't make an excuse for your blood draw person.
Right. And you could back that off because you've done this long enough.
Yeah.
You've known that the barrier is not drawing blood.
Yeah.
The barrier is the conception of, well, if I get a hip replacement, I know everything about that. I know the sequence, I know the timing, I know the statistical results.
Mm-hmm.
But this mumbo jumbo over here, where you're telling me we need to make my nutrition better, make sure that I'm oxygenating my tissues, and then tune that physiology so that it can self-repair. Well, okay, well, I don't have any medical literature, although we do now.
Yeah.
Yeah.
I mean, but when he was in school, there
Yeah.
was no medical literature.
Right.
And that's
that
what he
that
said.
you
He
could do
said,
that.
I need to do some research on this. I said, okay, well, you don't wait too long. Like,
Right.
Your hip is going.
Yeah,
like,
you can read those studies while you're recovering
Yeah,
from your
like-
hip replacement.
guess
Yeah.
what? And you know what? If it doesn't work, so be it. At least you tried.
Right.
That's
I mean,
what we
like I
tell
said,
people.
my goal when I got here was I don't want total knee replacements near 50.
Yeah.
How do we get me to near 70?
Yeah.
Right.
Right.
And the other thing is, I don't want to do nothing for 20 years either. I do want to go back and snowboard, right?
Yeah.
But I can't snowboard on a 280-pound body.
Right.
I need to get back down to 220.
Just listening to him say snowboard, I'm thinking of like when we took our kids. Well, I let him pick. Where do you want to go for spring break? Like, I'll let you pick instead of me
That's
picking.
a dangerous
And
bet
they're
with the
like,
children.
let's go skiing.
Well, with her though, every vacation is the last one. The boys are 19, 21. She thinks they're just going to move away someday. So every vacation, this is
Yeah.
our last one we'll have together. We have to do whatever they
Yeah,
say.
we blew out the last vacation when the last one graduated from high school. We did a blowout vacation in Hawaii. And
Oh,
that
nice.
was, we dropped a bomb amount of money on it, and we still to this day, some of the experiences were just, it was such a wonderful way to say, okay, we're changing.
Yeah.
the
Well, you know
things.
what? Like, I think that we're blessed because our kids like want to hang out with us and talk to us every day, and they want to be around us because we're so cool. And so I tell him like we won't always get that
Right.
much longer, just because like they're growing up and
Well, it's actually true.
I really get
You know
emotional.
that you have now
But
spent
yeah,
more than 95% of the hours you will spend with your kids
yeah,
in their entire life when they reach right about 18 to 20. That's
I
right
believe
where
that.
95% of it's
Well, our
already
one
done.
kid is like 19 and he's like over at his girlfriend's all the time. And I'm like, dude, you live over there. But our 20, he's gonna be 22, our oldest one. And so I just love like when we go on trips together because it's exciting. But I let them pick. We went. They wanted to go skiing. We don't ski. We go to the beach. I was like, whatever. They better have like some form of like a hot tub. So
Yeah.
we took them to Big Sky, and they were skiing. And our boy on the second day, he broke both of his legs.
Oh.
And so I was like, dude, you're not picking ever again in your entire life. So now when I give them options, it's either we can go to this beach, that beach, or this beach.
So that's called the magician's choice in parenting. And I remember when my kid actually figured out that I'd been doing this to them. He's like, Dad, he says, when you say, okay, boys, do you want broccoli or green beans tonight?
Oh, yeah.
And he's like, I
He
realized.
figured the game out.
I was like, yeah, he's like 14 years old. He goes, I realized what you were really doing was telling us we're going to eat our green vegetables for dinner.
Yes.
Yeah.
Right?
That's great.
There was no choice in the matter, right? And I was like, well, how did you figure this out? And I goes, well, in English class today, we can either write this essay or that essay.
And I don't
And
write
I was,
either.
and I was thinking, well, that's stupid. I got to write an essay.
Yeah.
He's like that,
Yeah, that's funny. How old are your boys?
So I have 30, 28, girl, boy, and then
Okay.
I've got 20, 21 and 19.
Okay.
Nice.
So I have
Yeah.
a
Boy, how many boys, how many girls?
girl, boy, boy, boy.
Okay.
Oh wow. Okay.
That's cool.
Yeah.
Yeah.
And every man should raise a girl. It would change.
I couldn't
around.
handle it. And
Well,
ju-
I'm-
I've got girl. 3 of them.
And in my house-
Including my wife and I.
Boys are so easy.
Yeah.
In my house, it's all guys. So I'm
yeah.
like one of the dudes. I'm like a
Right.
bro,
Yeah.
which I don't even mind because I had 4 brothers too. So
Oh,
But
well,
yeah.
Okay, so you've always been surrounded. by
yeah,
boys,
so I'm like a
right?
bro.
God, I've always been
Even my
surrounded by women.
customers, they're like, you're
yeah,
like a
and you're
bro.
the other.
Yeah,
the
that's
other
what my-
extreme.
And
you
you're
know,
like
my-
a girl.
Yeah, well,
you're
that's
more
what-
like a girl now.
And now,
I
I
don't know about that.
Now my girl. So my girl, who's 30, is now married for a couple of years. We have a 16-month-old grandson.
That's cool.
And I can remember when she pulled into my driveway, and I knew she just looked at me from the car, and I was like, "Oh, I know you're pregnant."
That's cool.
Like I knew it. And so I, because I'm retired
Yeah.
and I've got some time, I was able to the first year be over there 2 or 3 times a week and help babysit and offload the time and all the rest of the stuff. And I never mind being a parent. And watching it, you realize how much time and effort and strength it takes to be a really good parent.
Yeah.
And to see it come full circle and become a grandfather. The other amazing thing that happened to me is while she was pregnant, the mentoring that I did all transformed. I started not thinking so much in how do we fix you this month or this year or address this trauma thing.
Yeah.
I started saying, well, these are the things that will permanently transition your life to a better existence.
Mm-hmm.
Yeah.
And it was weird. It was like my father voice started to get replaced with the grandfather voice.
That's cool.
And then I came in here and I was like, I got to get more functional because I'm going to be chasing around after a rugrat here in a year and a half.
Real soon.
And I can't be with a toddler that can run away from me. That's
Yeah, you can't be on the ground and can't get up.
Right.
Yeah.
That's yeah.
Because that will happen.
Right, or your knees don't work.
Yeah.
You've got to be able to do that. So I've had some extra motivation.
Yeah.
This last year, as I watched him learn, month by month, closer to being more mobile and then walking.
That'll hit before you know it too.
Yeah. Now he tries to run. He gets 4 steps and face
False.
plants, but he can walk all over the place. And he's a really big kid too. For my daughter wasn't that big of a girl. My son-in-law is he's a huge Scottish hunk. So
Yeah.
Okay.
Yeah.
That's cool.
Yeah. So, but it's funny how life, and now I no longer think in terms of month, year. I'm starting to think in terms of decade.
Mm-hmm.
And once you start thinking that way, it's kind of easier to maybe not get the ice cream at night.
Yeah.
Yeah.
It's kind of easier to say, nope, it's Monday. It's your resistance training day. You are going to the gym. Look, here's 8 workouts to pick from that you're good at all 8 of them. So, pick one. And, the other thing I learned was I used to lift weights in my 20s and 30s. And I did this. Yeah. I mean, guys do this all the time. We would go to the gym ourselves. We do the same 8 exercises.
Yes.
Yep.
Yeah. For 12 years.
Listen,
Yeah.
Right. And I mean,
our
That's-
kids
that's-
are in school now, and so now I'm going to the gym with him Monday, Tuesday, Wednesday, Thursday. I'm like, dude, I'm training like a guy again. I'm like training like a dude again. Like,
Yeah.
you know what I mean? I'm
well, you got
like,
to change it up. I mean, once you get over 50, and I counsel people to this, is you should not be weightlifting like you're in your 20s.
mhm.
Sure, you should be doing resistance training, but the goalposts are not that you can curl so much or bench so much or squat so much or deadlift. Your goals should be, how flexible am I keeping my joints in my body?
Trash.
How much balance do I
Ours are
have
trash.
for how long on all 4 of my limbs?
Mm-hmm.
Right?
Yeah.
How much can I, take away some of my kinesthetic or proprioceptive strength
Mhm.
by closing my eyes or turning my head and not fall on my old ass?
Yeah.
Right.
Okay.
It's really hard though when you've been training really hard and
It
been
is.
lifting the weights
If
to think like, because if I'm in the gym, I want to be strong,
right.
and if I'm not lifting, I'm over here like I can lift more than 10
Well,
pounds.
and when you look at John Quint was a big one that beat me over the head with that, because your nervous system also adapts in recruitment patterns to repeated efforts. So like you can get really good at an exercise that doesn't necessarily equate to significant changes in the tissue anymore. Your nervous system's just more efficient at
Yeah.
recruiting that pattern.
Yeah.
And I always said, whatever exercise you're doing, you're not doing the exercise to be better at the exercise. You're doing it to train the tissue.
yeah.
So if you've lost the capability to elicit a change in the tissue, it's the wrong exercise, or the
exercise.
goal's wrong.
Yeah,
Yeah.
that makes
So
sense.
My big shocker was this nice strong body that I developed over time, and I was getting back. And I told my trainer, I was like, my daughter's pregnant, going to be here in 5 months, and he's like, great. He goes, today's workout is we're going to get up and down off the floor 200 times, and you're going to crawl around in different patterns on every 5th one. And I was like, are you kidding me? We go balls out on this machine, and there's I think it's by Rogue. We call it, nicknames the murder bike. But
Yeah.
like there are these machines that I'm like, that I can go at. And I was a very good swimmer, so I have a lot of cardiovascular capability. So I did not get up and down 200 times. I made it to 83 that day.
It would be hard.
That would be. Yeah.
Hold on. And I was crying. I was on my back, and I was crying, and I was like, "What's wrong with me?" And he goes, "You're very, very good at the bench press." He said, "But babies don't care."
Yeah.
And I'm
that's
like, "Dude, how
good.
are you 28 years old and know this?" And
Yeah.
he's like, "Well," he goes, "I just thought about what you would say to motivate you to do crazy exercise."
Yeah.
And he said, "So maybe we could work a little bit more on your balance, flexibility, and getting up and down off the ground."
I love that.
And so that's when he was like, "What do you think about yoga?" And I was like, "I'm not wearing Lululemon." And he's like, "No, what do you
Yeah.
what do you think about like starting with some basic yoga?" And I'm like, "Guys don't do yoga." And he goes, "Well, really strong, flexible balance guys who have neurodegenerative conditions on the left side of their body should be doing yoga in order to improve their longevity."
Wasn't it Lynn Swan that popularized doing ballet?
Oh, that's right. Yep.
I'm glad that you were here to share your story
this
with
was
us.
really fun,
This was so
Danielle.
good.
Yeah, no, thank
yes.
you. It was really nice. So nice, to meet you.
Yeah.
Yeah.
Dr. Buzz.
Yeah, thanks for coming
Joe,
in. As
great
always,
seeing
I'll
you
see
again.
a bunch more
And
too,
I'll
yeah.
see you again in the office here soon
Yeah.
on my next visit.
All right. So if
do A2M on his knee.
excuse me, hang on.
Oh, sorry.
All right. Okay. So
Oh, wait,
listen,
now we
they're
moved
still,
into my next visit there, Buzz, for a second.
they just can't stop. So,
Yeah.
anyways, if you're listening to
We're
this
always
episode,
thinking. We're always thinking.
shh.
Sorry.
If you're listening to this episode and if this sounds like you and you're like, what, and you want to ask any questions at all, drop it in the comments or hit us up. But we're so glad that you were here to share your story today. And Joe, as always, thank you for coming. Dr. Buzz, always putting his 2 cents in. And you know what? We'll just catch you on the next one.
Thank you guys so
Yeah,
much.
thanks.
Hey,
Okay.
thank you for coming.
But yeah, that was
Appreciate it.
awesome. What a great episode.